Welcome, dear colleagues. I hope you are doing well. It's great to have you here. Welcome to our Policy Roundtable on policy matters and engaging fathers in child's early years. We will try to unpack together how we will move beyond the EU work-life balance directive today. We will give more information about the project for eParent as well, but I want to go over the name for eParent stands for Early, Equal, Engaged, and Empathetic Parent. And here we are today with a greater purpose. Can you move the slide, please? Yes. We get together to collaboratively create a policy framework and work environment for a non-violent, gender equal, early and responsive engagement of fathers in caregiving. And this event is actually the fourth event in the series of online events on this topic. The goal of the series was to find out the most effective strategies for communication and advocacy together to formulate recommendations useful for both policies at the EU level, but also at the country level for driving the cultural and social change in terms of engaging men in early years. So here I provide an overview of online events. You can find them all in ISA website and ISA YouTube channels. And we have been, since the last year, we've been focusing on issues around engaging men, leave policies, uptake, and we dive deeper into these topics collaboratively all together. So I would like to give you an overview of the agenda today. First, I will invite for eParent colleagues to set the stage for us, what is why for eParent, why we're talking about these issues, and then we will move on to revisiting the work-life balance directive, and we will focus on the policy issues around it and how to address them in terms of length, uptake, payment of leave, and from a broader perspective as well. And then we will move on to workplace-related obstacles and opportunities. And our colleagues will provide some research findings on it, and we hope to dive in Q&A and discussion. And I encourage all the participants also use the chat function. If they have questions, we will collect the questions and we will try to discuss around them. We want to everybody's contribution here all together creating this collaborative work. So before I move on, I want to introduce our esteemed panelists. We are so privileged to have you here. We have together with us Margaret O'Brien. She's a professor emeritus of child and family policy in University College London. She's a pioneer in fatherhood research since the 1980s. She's a long-time contributor to the International Parental Leave Network. We are so privileged to have you. Thank you, Margaret. And we have Martino Serapioni. He's a senior research program coordinator in COFACE Families Europe. And he leads the research for the European Observatory on Family Policy, and he has previously focused on early childhood education policy in the University of Bologna. And we have here together with us Maddalena. Maddalena is an assistant professor at the University of Torino, specializes in men's studies, fatherhood, work-life reconciliation policies, and strategies to combat gender-based violence. And we have Anina Lubok. She's a former UN advisor on gender and social inclusion, and she's now leading the fatherhood section and shared care projects in Italy, and she's a consultant in EU funding for eParent project that we will give more information about the project. And Giorgio Tambolini is with us today. He's a pediatrician with a PhD in developmental pediatrics. He's leading the NGO Centro per la Salute del Bambino. I hope I say it correctly. And he's directing the ECD programs in Italy. He's also coordinating the policy efforts for eParent project and early father engagements. In a minute, I will give the floor to them. But Angela Giusti, I'm so sorry. She's the lead of for eParent project, and she's a senior researcher in the National Institute of Health in Italy. She will be presenting the 4eParent project with us, and hopefully she can stay with us. She might need to leave early, but we would like to hear from her as well. Now, I would like to give the floor to Angela and then Giorgio to provide us a very brief overview of for eParents project and the rationale behind why they are doing this work and we are doing this work collaboratively. So, Angela,
Thank
please.
you. Thank you, Isa.
Yes.
Yeah, can you hear me?
Floor.
Yeah.
Yes.
Okay. Okay. Thank you very much to Issa for the organization of this webinar. I'm Angela Giusti. I'm the project coordinator. I'm sorry for lagging because, I'm outside Rome and the line is very bad. Maybe I will switch off my camera so you can hear me, hopefully.
Yes.
Okay. So very briefly, I'm glad to introduce our project because I've been involved in several EU projects, and this is one of the most successful in my own experience, because we managed to put together the health sector, the educational sector, the social sector, companies, so private sector, and also policies and politics, and which is quite unique in the panorama of the EU project I've been part of. And this project is aimed to promote responsive and caring fatherhood and masculinities. And this is meant as a strategy, an evidence-based strategy to prevent violence of men on women and children. And I want to underline this because this is a CERV, CERV program of the DG Justice direction of the EU Commission, and it started in the end of the 90s with this specific aim. We want to tackle violence against women and children. And what we know by the work we are doing, all people that you see here, we know that we can break the chain of violence using the prevention and especially the promotion of the caring masculinities. And so today I'm very glad that we have this work led by Issa, because I think that we need a stronger EU directive, we need stronger EU regulations, because they are mandatory for the member states. So if we succeed in Europe, it means we are succeeding also in our countries. And so this regulation on paternal leaves, but not only, and more generally on parenthood, to reinforce these multi-strategic approach that we are promoting with the project. I think this is everything, because everyone here will be able to tell more and more specifically about the project. So maybe I leave the floor to Giorgio, or you do it.
Yes, thank you so much for the overview, Angela. We will now give the floor to Giorgio. Giorgio, please.
Thank you, Angela. And it's my turn to welcome all of you, and special thanks to Margaret and Martino. I just wanted to list very briefly the direction towards which we have moved in these past years. I think, Aita, you can move to the next one. This, and remembering that this 4E project is one component of a broader effort that all of us share towards what Angela has briefly introduced and described. We have moved essentially in three directions. The first, of course, is regarding paternal leave. We want to make it more accessible, more convenient for all categories of workers. And of course, this entails that the leave should be adequately paid. Second point, we want to move towards a longer duration. This is an issue particularly open in our country, in Italy, because what we know about the benefits for children, mothers and fathers, and can be consequent to a more early engaged fatherhood, depend also of an adequate duration of leave, giving all fathers the possibility to engage. Can I just have next one, Aitza, please? The second direction, of course, is to work at grassroots level. We have a fairly good experience now in moving at grassroots level with all kind of campaigns, information, leaflets, materials, training modules, including the direct involvement of young men and fathers in many Italian cities through what we call the circle of fathers. And third, and I must say this is a relative novelty for many of us, we have started a collaboration which Angela has already mentioned with the corporate sector. First, to raise their awareness about the importance of facilitating within their welfare policies and early paternal engagement within, of course, a responsive caregiving framework for both parents. And so we have been able, but Maddalena will get into detail about this, to support companies in improving their relevant policies. But also we think it is good to have the private sector as an ally rather than an obstacle towards what we can define as more generous parental and paternal leave policies in each country as well at EU level. So this is the reason for which we're interested to move beyond the past directive and see whether at European Union level we can achieve what at country level can be difficult, at least for some countries in particular. So this is what I was briefly going to say, just to introduce and set the stage. And thank you all again for your participation.
Thank you so much, Giorgio, for providing guidance to our discussion. Not to lose time, I would like to start and continue with our panel discussion. I would like to invite Margaret O'Brien. She's going to talk about the various types of leave with a focus on fathers, exploring aspects of eligibility, uptake, length and payment, and the impact on child well-being and also parental well-being. And she's also going to touch upon the importance of cultural acceptance and awareness in successful implementation. My colleague is helping us out to put up the presentation. Yes, we should be able to see it now. Thank you, Margaret. Now the floor is yours.
Thank you. And next slide, please. I'm speaking today on behalf of two really important programs that are going on globally, the International Parental Leave Network and an EU-funded cost project on parental leave and social sustainability. So thank you very much for eParent for inviting me. And I think it's a fabulous initiative. And it's great that it's happening mainly in Italy, but will cascade out across Europe. I wanted just to kick off by reminding us all about the evolving context of leave, because it links to the cultural issues. Just before COVID, we had the 100 years anniversary of the maternity protection. And that was the post-war first time globally that there was a signal that parents, in this case mothers, need protection, job protection, and also time with their babies after birth and before birth. So we had the 12-week beginning signal in the world at that point, hard fought by many, particularly because at that convention, which actually was in Washington, DC, can you imagine then, that given that it doesn't have any parental leave provision at all now globally, it was hard for women even to be at the meeting. Is mainly male trade unionists. And then over the years, we've had this extension of maternity leave in terms of global minimum standards from 12 to 14. And the International Labour Organization signaled that birth mothers need 18 weeks. But that is not always, as it were, supported globally. Very interesting when you look at the trajectory, fathers were not mentioned, and the ILO has found it very hard to get consensus on paternity leave. We had, in the European context, the great mover and shaker of the Commission. So, but first of all, we had Sweden out there with the 10 years called paternal leave in the 70s. And then the EU had the directive on maternity pregnant workers, matching ILO 14 weeks. And moving forward, we had the parental leave, which then began to incorporate fathers or partners. But it wasn't really until the directive, and we have to be positive, I think, about the directive, although we want it to be improved, that it's the first global sector of the world that has been father incentivized in a way. We've got the 2 months non-transferable, paid, okay, not at the best level, and for the first time, paternity leave mandated. Many countries had paternity leave before, including my own, but some didn't, and some it wasn't paid. Next slide, please. As I said, and these slides can be shared, the International Network on Leave Policies and Research has been going on for many years, and it's a great group of scholars and policy experts. And we just published our 20th anniversary issue, references at the bottom there. And if you want any information, including on it from Italy, on what the provision is for maternity, paternity, parental, care for sick children, and other types of provision, it's all in there. We have experts auditing every year. And now we are 51 countries. So it's not only Europe. And one of the great innovations from my colleagues this year is there are, led by Ivana Doprovic from Croatia, there's an online Excel sheet with all of this information for 2003-04. Hitherto, it was analog and so quite hard and clunky to access. Next slide, please. Okay, fathers. In the middle, there's my first book on fathers. You know, we often call this period the discovery period. That book was actually in 1982, part of my doctoral thesis. And, you know, of course, as many of us know, have fathers who work with fathers, men themselves and fathers and know, they are significant and relevant in sociologically, psychologically, historically, of course. But this period was a sort of first wave of discovery. And the idea that you could talk to fathers about their experiences was relatively novel. In fact, I had friends at the time when I was doing my PhD at the LSE that said, why are you talking to men? They're irrelevant. You know, in fact, I had quite a lot of criticism from feminist friends about talking to fathers. But we found through that qualitative and quantitative work, working Ulla Bernberg and others in Sweden, how important paternal experience is. And I will just, you know, there's a whole body of research now since that period, much research. Next slide, please. Okay, and I'm summarizing a lot of work here, apologies, just picking some of the issues. The team for eParent asked me to speak a bit about the impact, about payments, duration, and other things. So you can imagine this work on fathers has had to build on the extraordinary epidemiological and demographic work on mothers taking leave. And we know from scholarship that when mothers take time out to care for their children, take maternity leave in the early period, it improves immunization rates, child health and mortality, morbidity generally. And there's been a growing number of studies on, well, what's the impact of fathers taking leave? Paternity leave and parental leave, often conflated here. And we have these also country experiments, before and after experiments, that are also very helpful. And one of the methodological issues is, well, isn't there selectivity into these studies? Are you only studying fathers who are very engaged fathers, engaged in parenthood, wanting to be fathers beforehand? And many of the quantitative before and after difference, it's often called by economists, have been able to control for this in their studies. And there's a body of work essentially that does show, I've mentioned maternal, but benefits of fathers taking leave for their own mental health, child well-being, broadly defined, whether it's physical, and also there's some cognitive, emotional development, particularly maternal labour market retention, sharing of childcare, and coupled stability. I mean, this might seem a bit like a magic bullet, but underneath all of this, there is body of scholarship. That said, often when you check the methodology sections of papers, the actual variable can be interrogated, in that it's often provision of parental leave or paternity leave or father-only months, and it's not necessarily uptake. So there's still so much work to do. And we've got this Pandora's box about what actually goes on in leave when fathers take it, and indeed mothers. And some work I did with a Portuguese colleague called Fathers Taking Leave Alone, qualitatively, showed it's not men going on holiday, although of course couples and families can go on holiday in their leave. They are allowed, of course, but there are caring, housework activities, time with children, time to sleep while the child's sleeping, and so on, that there are pro-family and pro-child activities, as well as, some, as it were, typically stereotypical partner male activities as well. Some of the mechanisms behind this we think are important, that the enhanced availability of fathers supports the mother, the co-parent, and the processes of co-parenting can be initiated and also supported. My colleague Catherine Thornley has just published a book showing there are tensions as well. Her book Caring is Sharing. It's a very good book. It's online, and it's actually free, as it were, to read. Shows that this caring by fathers during leave is not necessarily equal. There's a different theme there of equality and engagement. And some of us in the field thought that more caring would mean equality. And now there's a lot of interest in what's enough. And maybe we're conflating two issues here, gender equality and child well-being. We'll come back to that in discussion. In terms of duration, it's really important that we're culturally, we're in our ecological cultural context, because the paper, for instance, here by Zhen Young from Singapore, shows that 2 weeks she's been able to show in Singapore 2 weeks has an impact, very rigorous piece of work. 1 week is not important, in fact, can create tension, but 2 weeks for Singapore men and fathers actually does make a difference to couple co-parenting, child indicators. In the European context, we're more concerned and interested in the duration of the 6-month period and time together, as well as solo time. And research on the importance of fathers spending time with their child alone means they may get more time to get competent and confident. Next slide, please. Okay, going back to the take-up issue, we know now that body of scholarship on leave suggests that we know the design that works, non-transferable, individual entitlement, and high income replacement. I'll go on to that in a second. And I just to look at this display from colleagues Berit and Ellen in Norway, who are the key researchers in Norway on the father's leave, shows us historically the moment the father's quota was introduced, paid quota, we had this significant uptake in leave by fathers. And and it's been maintained. They've got a really interesting book out on this over the years since. But I just want to also say, because not all of us are as rich as Norway or as small population-wise, what they did was introduce in a way that was not competitive with maternity or mothers' access to leave. It was generous to mothers as well as fathers, and it was culturally endorsed. And I think one of our problems in Europe, across the world, is there's not enough cultural work on normative changes in trying to understand the place of fathers in families. Next slide, please. Payment, really, really significant issue. You asked me to think about this minimum standard that's in the directive. Well, in the International Parental Leave Network, we've always categorized well paid as 66% of earnings or more, or a flat rate that's equivalent to €1,000 per month. But research from Sophie de Vander and others in our leave network, Asbetta in Netherlands, for instance, and Barrett's, she's found that this may not be an sufficient incentive when we have this upper limit, particularly for low paid fathers. And if you, I mean, it's significantly more for paternity leave and parental leave than many countries, which is, you know, very low flat rate. But that seems to make a difference in our analysis, that we do see the uptick. But just want to also make the point, it may not be enough for some father workers, because particularly the low paid workers, because, you know, income and their partner's not working, income is so significant. And if you look to the gold standard, as it were, Swedish case, the paid leave for mothers and fathers is much higher, nearly 80% of earnings. And majority of fathers do take leave, and they take 30% of the leave period on average, from the recent data we have. And they tend to take it, there's obviously the parental leave period, paternity leave period, just after birth, which is more or less universally taken up. And then you get the this parental leave period, which tends to be the pattern that fathers take it towards the end of the first year and into the second year. That pattern historically has been one that we've noticed. If you look at the Iceland situation, where they initially had 3 + 3 + 3, 3 months ring fenced to each parent and a shared 3 months, fathers tended to take their earmarked period and not get into the mothers, the mixed period, as it were, the shared period, but they take it, and then there'd be more taking of leave after that 3-month third block. Next slide, please. I mentioned this very important project that I'm part of now, and please check it out. I think you'll find some interesting material. And I just want to flag up 3 things for you from this project that relate to today's seminar. Next slide, please. Colleagues are monitoring, are looking at the data that we have for monitoring leave across Europe. I've mentioned the Parental Leave Network Excel sheet, but in addition, colleagues, there's a big team, and this is Croatia and Iceland leading, looking at all the surveys across Europe and trying to see what can be gleaned from the data, the variables they have to understand leave monitoring. And I know the Commission are very keen to understand this as well. What survey should be used, and they've made some very important points in this report that you should check out. That sometimes some of our surveys in Europe don't even distinguish between the different types, between paid and unpaid leave. So they can't. It's only with the administrative data that we can look at the patterns I've described before, or national level administrative data. Often parental leave is conflated with maternity leave. So it's difficult to disentangle the behaviors of mothers and fathers, partners. And sometimes poorly paid quotas are mixed up with well-paid paternity leave or paternal leave. So we can't work out difference between the quota and the money in the analysis. And finally, I mean, there are other criticisms of our whole range of surveys we have, which are very important surveys, but often they're not linked to the child. So we're not sure how many eligible children, as it were, in a year that are born don't or do get leave from their mothers and fathers. That's very possible, obviously, in the Nordic countries that have registered data, but this child-centeredness is not generally available in other forms of data. Coming to the end, and I'll stop one more, just 2 more points. Next slide, please. What they suggest is the survey that many of you may know, Generations and Gender Survey, as well as the Labour Force Survey, is probably the best data source on parental leave, but not the only one. We're talking here about data rather than the provision, the leave design issues. That those characteristics are best, I think, from our network database. And the good thing about Generations and Gender Survey is that it asks about each child, the duration, flexibility, and the benefits of the father and the mother. The disadvantage, however, is it didn't actually cover paternity leave if we're trying to use it for tracking the directive. So there are problems even with that one. So look at Alsbeta's paper to get out more information on that. Next slide, please. just want to finish by saying that a group of us in the COST program are thinking it's quite important to take the child's perspective in all of this as well, not quite very, because often we think about what's the best duration of leave or the best financial recovery of leave from the parent's perspective or the workplace's perspective. And there's tended to be a silo approach that, the gender equality experts don't talk to the child well-being experts or the economists. And it's as if we can't find out what's best for all the parties in this very important period of children and parents' lives. So the moment we're working on a white paper to be reported on next year, called Sustainable Parental Leave Policies for Children. And it's quite a challenging paper to write, can I just say, because we work mainly on men's perspective. Gender equality has been my field, but we want to try to foreground what's best for children as well. And can I just say that one of the things that we're thinking is long leave, a year. And in fact, implicitly, Sweden and the Nordic countries do this because leave goes up to 18 months. Then there's great integration with early childhood education. But if you have that and also engage mothers and fathers for at-home care, you might be influencing women's economic recovery and all of that. So there are massive issues here. And, can we afford it in our current climate as well is really relevant. And thank you. Finally, just the image I'd like to share. When we first started on this, there's a lot of publicity. This was a Nordic post, and we need more of this, I think, particularly with toxic masculinity discourses being so dominant in the world just now. Thank you.
Well, Margaret, thank you so much for this overview. I think you really compactly summarize all of the questions in our minds, and thank you for providing all of these. It's so great to see, indeed, that we can together think about taking the child's perspective, because also as ISA and for eParent, this is one of our goals as ISA being the early childhood network as well. We want to always bring the focus on the child within all of these discussions, and I'm happy to hear, and I hope to discuss it furthermore. Not to lose time, I would like to invite Martino to speak. He's going to present insights from COFACE's Observatory of Family Policy, focusing on breaking silos approaches by aligning parental leave with ECEC services and engaging fathers more actively in caregiving. He's also going to reflect a little bit on the 2019 EU directive on work-life balance, and providing a broader work-life balance framework in coordinated family policies. Please, Martina, the floor is yours. Thank you.
Thank you, Aisha. Good afternoon to everybody. Thank you for the invitation. I'm very grateful for this opportunity to speak in this context. And yeah, my name is Martino Serapioni. I'm the research coordinator for COFACE Families Europe, and I oversee the Observatory of Family Policy, which is a platform that we founded, putting the timer, I want to be sure it's quick time. A platform that we co-founded with Odyssey, University of Applied Science, a couple of years ago. And through this platform, we've been mainly exploring in recent years the various initiatives and models of family policy coordination that have emerged across the European Union, again in recent years, with a particular focus on initiatives that cater to families with young children. I wanted to begin with a brief contextualization. COFACE is a civil society network with more than 50 national family organizations distributed across Europe, and we've been very active for several years at this point on the front of campaigning for gender-responsive work-life balance measures for all. During the years leading to the agreement on the 2019 directive on work-life balance, COFACE led the work-life balance coalition of NGOs. Reaching agreements was extremely challenging, as you know. Let me briefly add about our approach. At COFACE, the way we approach work-life balance, the notion of work-life balance is with a strong family-centric and multi-generational lens. For example, when discussing leave policies, we tend to see them as just one piece of a larger interdisciplinary, intersectoral puzzle, the puzzle of meeting families' needs during the first 1,000 days of life. This is a critical period when economic, social, healthcare, and work-life reconciliation challenges intersect, making holistic and integrated approaches essential for devising an effective response. Now, if I'm to sum up our attitude towards the directive of 2019, 5 years later, in one or few sentences, I would phrase it as follows. The directive was, from our perspective, a step in the right direction. In itself was a step in the right direction. Of course, we firmly advocate for upward convergence, and for an organization like ours, it was somewhat disappointed back then to see the Commission original vision for EU minimum standards across the board concerning parental and carers leave, that vision being diluted and these standards being deferred back, pushed back at the national level. And yet, like, I don't know, like the EU operates with its own constraints, and we know that, and the national prerogatives remain distinct, and about the platitude, apologies for the platitude, but like the EU is the EU and the national is the national, and from this perspective, the transposition of the directive, we have to acknowledge, has acted as a catalyst for change within the family policy domain in many EU member states, sorry. And this focus on the transposition has been central to our COFASE approach since 2019. Like, transposition is the key. And when I say this, I emphasize this, the importance that transposition had and still has. I say that not merely with respect to integrating the directive's contents into national policy frameworks. More importantly, we view transposition as an opportunity, as a unique window of opportunity for national actors and stakeholders to reimagine and reform their systems. And by reform the system, I mean the creation of comprehensive work-life balance frameworks, particularly in national contexts where no such comprehensive frameworks existed previously. And this perspective has been central to our work at COFASE in recent years. Part of our efforts when focused on monitoring the transposition of the directives, like specific provisions and at member state level, and it's a task my colleague Attila Bohm has been leading. But beyond that, our work has also deepened in a different direction, and we've been exploring how member states can develop what we call competent systems of integrated work-life balance policies. These are systems where the different elements of family policies that cater to families in the first 1,000 days of the life of the child don't just coexist, but actually work together, aligned, complementary, and reinforcing one another. And this is about overcoming that fragmentation that has, like, historically plagued this area of social policy, like moving towards something more unified, more impactful, and ultimately better for families. And one key concept that we've been working on, which directly relates to parental leave policies and highlights the issue of fragmentation, is what we call the childcare gap. This refers to the period of misalignment after the end of well-paid or adequately paid statutory parental leave, when families have not yet gained access to formal, publicly supported childcare services. And during this gap, and there are only 6 or 7 countries in Europe at this time that have no childcare gaps at the end of adequately paid parental leave. And during this gap, families are left without sufficient public support to meet their childcare needs, forcing them to like rely heavily on their own caregiving abilities or financial resources if they want to pursue childcare on the private market. And from a family perspective, this concept is extremely important because it emphasizes the complementarity that exists between parental leave frameworks and the early childhood services frameworks. Now, these two frameworks may look fundamentally different because parental leave allows parents to step away from work to care for their own children, while childcare services do the opposite, providing alternatives to family caregiving, but they share a common purpose, which is to support families in balancing their professional and caregiving responsibility, let's say, during a crucial phase of transition when work and care often for the first time intertwine in the life of family. And despite being managed by different institutions, these two measures should work together seamlessly to bridge that gap that exists between exclusive family care and professional childcare. Now, why am I bringing this up in this context? Because like from our perspective, achieving work-life balance for families requires a well-rounded policy mix. One that provides families with time, with resources, and with services. And since the approval of the 2019 directive, which focused arguably primarily on the time and resources components, we have observed that some encouraging progress, complementary progress at the EU level regarding the service dimension also. And I'm thinking the approval of the recommendation on the child guarantee, the recommendation on the European care strategy, and the recommendation on the renewal of the Barcelona target for 2030 on early child education and care. And these are noteworthy examples, and these measures if we look at them through this like complementarity lens in family policy, have helped to keep open more than alive, that window of opportunity that that opened with the European Pillar of Social Rights in the spring of 2017, and the work-life balance package that was like the first measure. They point towards the possibility of more, the possibility to work at the national level for more integrated and inclusive national policy frameworks is still open. The importance of ensuring that different areas of policy work together in a complementary and aligned fashion becomes even clearer when we talk about the gender responsiveness of family policy. And this is absolutely key, we think, because if we fail to embed gender responsiveness into the fabric, into the broader framework of all measures aimed at ensuring work-life balance for families with young children, for example, it's hard to imagine how the design of any single policy can succeed in effectively address structural inequality. And now this is absolutely not to suggest that design of parental leave doesn't influence parenting practices, because it clearly does. It shapes fathering practices, is absolutely, undeniably important. But for family policies to be genuinely gender responsive or gender neutral, and to achieve the gender transformative impact on underlying social norms, these principles must underpin the entire system of work-life balance measures. And this means extending beyond the parental leave frameworks. Gender responsiveness must also guide the design and operation of PCC childcare services as social and healthcare services that families, particularly new parents, meet in the perinatal phase. And only then we can ensure that family policy truly promotes equality and supports all family members in the meaningful way. And sorry, I close, I'm late. From this perspective, ensuring that member states move beyond the unambitious standards of the 2019 directive, especially when it comes to engaging fathers in early caregiving, challenging normative like prescription of fatherhood, and fostering those caring masculinities that were mentioned before, this requires framing these goals as systemic objectives. And these objectives must serve like a fil rouge connecting all the key sectors: parental leave, prenatal care, postnatal care, parental guidance during the first 1,000 years, early childhood services. And by thinking of these goals systemically, we can set an agenda for integrated, competent, gender responsive work-life balance frameworks that not only support families with time and money, but also drive cultural and societal change towards I think greater equality or gender equity, let's say. Sorry, I apologize for I went too long, but did my best.
No, thank you, Martin. I think I was listening to you, and it really opens up many doors in our minds. It's great to see what Margaret brought, and you provided also a broader perspective for us. I think each of us in different ways, we're trying to collect the pieces of this puzzle all together, and I'm glad that you mentioned them as well. Thank you so much. Yes, like 8 minutes behind, but I think we can cover it up. And now what we need to do more, I would like to hear from Anina to provide the Italian case, and then I would like to give the floor to Maddalena to talk about the research that they did with companies. So please, Anina, go ahead and provide us the Italian case. And then we will move on, and then hopefully we will have a bit more time to discuss all together. You're on mute, Anina.
Okay. Margaret and Martino raised some very important issues that I hope we'll be able to discuss today, but are, I think, issues we need to continue to work on together. I have 5 minutes, and I'll try and stay within those 5 minutes. How do I move on here? What have I done? Okay, no, that's wrong. I think I've done something wrong.
No, we can see. You want to go back?
Yes, no, but I need to go back.
This is the first one.
Okay, this is okay, right. Okay, so the Italian case is a pretty good example of what we would call partial transposition, but regrettably with few prospects, at least for now, of moving beyond this situation. I think many of you are aware of the situation in Italy, where we have 10 days of paternity leave, or 2 working weeks, according to which category of worker we're talking about, which is, of course, the minimum EU standard. Days to be taken within the first 5 months, and at 100% pay. The entitlement to paternity leave is not by any means universal. There are many categories of workers that do not have the right to paternity leave. Of course, leave is also provided by companies, but these tend to be large companies. Maternity leave in Italy is 5 months at 80% pay. It's one of the most generous in Europe, which means that we have in Europe the highest gap between paternity and maternity leave. Parental leave is 10 months. Each parent can take a maximum of 6 months. According to the law that established parental leave, payment is 30%. Over the last 2 years, each year 1 month has been raised to 80% replacement, and they're now proposing that there should be a 3rd month in the budget. This is in the budget bill for 2025. However, these 3 months, which are now available at 80% replacement, are transferable, which of course is an issue. The situation in terms of take-up in Italy is that it's increasing. We now have an average across Italy, which is 65%, but with very major regional differences between the north and the south, as you can see from this map. And the sort of prevalent profile of the user of paternity leave is they're mostly fathers from the north with stable contracts and working in large companies. And this seems to be the pattern across Europe to a great extent. Now we're advocating for change as a project. We've been doing that since the beginning, and we were doing that before as well. However, the context today is that we've had a change of government since autumn 2022. Recall that the transposition, the law which transposed the directives was in June 2022. This change of government has entailed a change in priorities, a change in culture. And then we have our budget constraints, which are to some extent due to Italy's situation. It's a highly indebted country, but also to choices that are made at government level of where to put the resources. We're not making progress towards the goal, the long-term goal of equal leave, which is broadly shared, especially among the opposition. However, there was a vote in December of last year, and the order of the day was approved both by majority and opposition, where there was a commitment to extending leave for fathers with the aim of eventually reaching equal leave. However, a year passed and nothing has happened. Obviously, having maternity leave at 5 months sets the bar very high for equal leave. Having actually equal leave plus another set of measures like bringing maternity leave payment to 100% would cost around 4 billion euro, and still we wouldn't have met the WHO standard for 6 months women's leave after birth. So how have we tried to advocate, say, across the political spectrum? We've focused in terms of the rationale for father's leave as a project, we've focused more strongly on the benefits for the child and the welfare of mothers in the first 1,000 days, because we've found that there are certain parts of the political spectrum where this resonates better than an approach that is focused primarily on gender equality. We've made some proposals for the current budget law, which is being discussed now, which should be finalized by the end of December. We have suggested to start increasing paternity leave, increasing it from 10 days to 26, which is a month, with an initial continued period of 10 working days or 2 weeks, because this is tremendously important. However, this is also quite costly. It's estimated to cost 120 million euro per year. We've also suggested some cost-free or almost cost-free measures, which should be hard to reject. We've proposed that the 3rd month of paternal leave, which is being raised to 80% replacement rate, should be non-transferable, which would increase uptake by fathers. We've also proposed measures to improve monitoring and reporting on uptake, because we know how many, for example, how many fathers actually use paternity leave, but we don't know how they use it. So how many days, when they take them, consecutive, non-consecutive, and so on. And the same applies for parental leave. We've also proposed an awareness-raising campaign targeted to families, but also to employers in order to increase uptake. There was an interest, we've been talking to people from the majority. There seems to be some interest in the latter two, possibly some interest in the 3rd month, the non-transferable 3rd month, provided, and we've made a suggestion there, we compensate for the fact that since it's paid 80%, it means that if the higher earner of the two, and that is often the father, takes the leave, the financial loss for the family is greater. So we've actually proposed that the 20% that's taken off should be based on the earnings of the parent who is earning less. But we don't know how that will go. Now, some of the issues and the objections we're coming up with, okay, this was the pay gap that I've mentioned. there's a resistance to this. There's some resistance. It's mainly in the majority, the parties in government, but also some sectors in the minority, in the opposition. Resistance to the concept that leave should be compulsory or mandatory. But this is strange because this issue is raised only for fathers, whereas the fact that leave for mothers at the beginning is mandatory, compulsory, is now accepted by society. So there's an issue there. Connected to this is the issue of non-transferability. There is some resistance to this. Of course, having some parental leave at 30% is a major disincentive to uptake, but even for women. And the fact of having only 10 days encourages a very fragmented, and I call it kind of contingency-based use of paternity leave by fathers saying, okay, I'm going to save those days for when there's some kind of emergency and when I'm really needed, which deprives fathers of that first important continued period at home after the child is born. And of course, we struggle with the fact that we don't know enough about how much leave is taken and how. However, I think, as also Martino mentioned, I mean, leave policy is just not the only obstacle. Of course, having good leave policy is important, and it also helps to change culture. But there are a whole host of workplace-related issues, which my colleague Maddalena will be talking about now. Thank you.
Thank you so much, Anina, for providing. I'm wondering also among our participants in their countries, do they resonate? I know there are a lot of different contexts in different countries, but it's also important to have a unified understanding where we're heading. Maddalena, I would like to invite you to provide us insights from the research that you did.
Yeah.
Thank you.
Good afternoon to everybody. Thank you very much. So today I'm going to report on the work done with the Centro per la Salute del Bambino within the scope of the work package 3, which was addressed on the companies and on company level policies and issues, I would say. Actually, we worked with Mara Piazentin with 6 companies, Italian companies, 5 big and 1 small company. And we collected 123 questionnaires, and among these respondents, there were 207 mothers and 480 fathers. But we decided also to conduct focus groups, and we conducted 13 focus groups with 57 participants and 6 interviews with 3 women and 3 men, all HR managers. So as a general characteristic of the sample, both of the questionnaires and the quantitative questionnaires and focus groups, we can see that the participants were mainly based in the northern Italy, highly educated, and around 40 years, and 38 for men and 38 women. So what emerged from our results? Of course, today I'm going to present some brief insights about our research. Of course, they are far richer than that. But please feel free to answer any questions or requests for clarifications. So from the quantitative questionnaire, it emerged that there is a strong desire to feel free to express reconciliation needs in the workplace. So fathers and mothers, but also people without children, for example, people who are planning to have children, because they participate both in the questionnaires and in groups, because they were a little bit cared about parenthood. So they express this desire to have a more supportive workplace about parenthood, and in general reconciliation needs between private life and work. And it is very interesting for us, the vast majority, I mean, almost, if you look at the percentages, they are very high. And so they express this desire for training for managers and supervisors about work-life balance issues, also for fathers. And another very interesting aspect, which is strongly connected to the qualitative part, so to the results that emerge from the focus groups and interviews, is the strong request for compliance with the standard working hours. Because in Italy, we have, and I think it is a general trend, but Italy is very peculiar from this point of view. We have this exaggerate workload in terms both of workload, but also on working hours. And of course, this is very important when we talk about parental leaves and we talk about work-life balance. In fact, what emerged from our qualitative data is that there is a strong generational fracture about older generations who were more devoted, and especially the managers now, supervisors, let's say, people who are in higher positions that are very, business oriented, profit oriented, while younger generations ask for more time for private life in general, not just for parenthood, but also for to dedicate to their private life. So there is a very important issue around the values, and also the very importance of work in one's own biography and lifetime. So and actually this is a huge problem when we look at parenthood, not only because it causes conflicts between workers and their managers or supervisors who belong to these older generations, but also because it creates a very inequalities among the parents, even in the same company, because it depends on how your manager or supervisor consider parenthood and the right of workers to work-life balance and to reconcile parenthood. And another interesting aspect, as I was mentioning before, is connecting to the overwork. All the people who participate in the focus groups said that they are working too much and too long. It was very interesting to hear them, for example, in the quotation on the right, on my right, this dad says, it would seem that for what we do in our company, you either do it 150% or it is difficult to do it at a lower percentage. So, if work occupy the 150% of time, of course, you do not have time for to be a parent. And it is very interesting for us because, as you can read in the quotation below, this man says that he didn't take the 10 days of paternity leave because, so that would be compulsory in Italy, at least from a technical point of view, let's say. He didn't take these days of paternity leave because the pressure was too high, but not by the company or the pressure from the boss or from the supervisors, but because of the workload. So the amount of, there is this impression, of not being free to, to detach from work for 1 week. We were talking about 2 weeks. Starting from here, we thought about possible recommendations, but also to other reflections that we can add to the discussion. So first of all, the importance to think about what does compulsory mean in each country and how this is put into practice in relations to paternity leave. So there is it is very important to reflect about this point and about what we can do at a company level. On the other side, we thought about the gender equality certification system that exists in Italy. So, of course, it can be an incentive to make workplaces more parent-friendly. For example, already exists some tax benefits for those companies who reached this certification. However, there are no controls about it. There are no regular controls about the measures implemented and the kind of workplaces they are really building. And on the other side, we could think about this certification as a sort of prerequisite to access to public funding or to other public tenders. And another thing connected to the small and medium enterprises could be to support the temporary replacement of the workers in paternity and maternity leave. I mean, giving support and finding in a short time a substitute for people who have to go on leave maybe would help the company, but also the people who work in the company. And on the other side, this is maybe a very specific issue on the Italian context, is the fact that when a worker go on paternity or maternity leave, the company has to pay them in advance, and then the state will refund them. So we could think about a possible system of when the state advanced this economic compensation especially in favor of the small and medium companies, which are the most affected, this element. So thank you very much. I hope I was in time.
Thank you. Yeah. So, we are 10 minutes behind or above. I couldn't find the right word, but I think these were all very, very valuable to reflect, to think about, and you posed us in questions, ways forward. So I'm really wondering, from all of our panelists, I want to invite you now. We have 15-20 minutes left to react and reflect. And what do you think the ways forward? What are the priorities? How we can go collaboratively together from this point on? I see Giorgio unmuted. Would you like to start, please?
Well, yes, I think a lot of complexity was put on the table, and unfortunately, I'm kind of ready to put further complexity on the table. Also, because I've been stimulated by last thoughts by Maddalena. Maddalena and Mara took a very qualitative approach, a narrative approach, which I think is extremely powerful and should always be combined with figures, numbers, and quantitative approaches. Now, having worked for decades on fixing health system around the world, I quite
Giorgio, I think we have some technical issues.
Yeah,
Giorgio?
you're freezed.
Yeah, he freezed.
is what happens between
Giorgio.
that. that
Giorgio,
opportunity and the
sorry,
youth.
Giorgio,
Yes.
can you hear us? We lost you for a moment. Can you please repeat
Oh.
last minute or and a half?
Yeah, I said I was taking
Yes.
example from my past work on health systems,
Yes, then
saying
we
that
lost
saying that the quality the quality perspective is very important, because once you have offered an opportunity, could it be, you know, the availability of a drug, of a health service, in this case of paternal leave, of a good policy, you know, of paternal leave. The point is how the people use and what kind of interaction is between the health provider, or in this case the policy provider, and the person using it. Because of course one could just take the paternal leave and not use it effectively. So what is behind this effective use? We have a lot of fathers we should, I think, interview in order to understand what was the path and what were the determinants that brought them to use the paternal leave by being engaged with their child and with their partner. And even those that didn't have access to paternal leave, sometimes they get engaged. So the point is that we have to explore the paths that all these fathers take in this apparently good move towards a more engaged fatherhood. So in the multi-sector framework that I like a lot, because we are working on this, that Martino described, I think we have to take also into account not only the services, I mean the goods, the service that we provide, but also the content of these services and the relations between health workers, social workers, early childhood services workers, and parents, and what kind of message, what kind of incentives are coming from there. This is just to, as I said before, I'm afraid I put further complexity, but here we are free. We are not having today a very clear objective. We want just to take the whole issue further. On one side, we have what we should do once the commissions within the European Union have been set. Should we try to convene another even if the project is finished, should we move together in a way to convene another group of parliamentarians to discuss these issues and how to bring them further? And at the same time, should we continue to research about the individual paths and what makes a father an engaged father? And how the paternal leaves are used in different countries. Because one thing I observed, once you have one hospital, one health service with exactly the same human resources, the same drugs, the same commodities, sometimes the quality that they provide is totally different. So once you get an insight in this, you understand what you have to do and what is the work you have to do at a grassroots level with health professionals, with education professionals, etc. Just I'm sorry for making it even more complex, but I will just
thank you, Giorgio,
that's
for bringing this perspective.
My thoughts on it. Thank you.
Yes, I'm wondering what our other panelists has to say. I think Margaret, you would like to comment.
Yeah, thank you, Giorgio. I think that's a really important observation, and I really also found the other presentations fascinating. I think change takes a long time, 20, 30, 40, 50, a millennium possibly. And there's great diversity in fathers, as in mothers, of course. And, you know, you talked about, well, what do fathers do and their own pathways and the importance of qualitative inquiry. The work we did on fathers taking leave alone was a comparative qualitative study, and it did raise the importance of the culture and environment. So, for example, you know, in Norway, again, great joy, fathers taking the baby on skis to the mother's workplace for breastfeeding, for example, during this time. In Japan, our colleagues were describing fathers feeling very forlorn and unhappy, that their colleagues at work pitied them. You know, you've got to look after this child on your own. How awful. How are you managing? And so I think the cultural context matters as well as the policy. As you say, it's the reception of the policy and the feelings, the emotions around it. And I was quite interested in what Maddalena said about the existential feelings of Northern Italian workers, that they've got to be on call all the time and work 24/7. I thought that wasn't happening as much in Italy. My stereotype of Italy is that you're, as a country, a bit more connected to good food, quality time, etc. But I have Italian friends in London that say it's not like that. So I know there's great diversity, and I'm being stereotypical, but it's sad to see that there's a feeling that even if I'm allowed to take this time to be with my family, I'm not going to do it because I've got too much work in my mind. So it's not answering the question, but I think we need to continue having more qualitative accounts as well as quantitative data in this field, surely.
Can I just quickly answer to Margaret?
Sure.
It is very interesting because I conducted a similar research during my PhD 10 years ago. And what we found today is that the situation is getting worse. I mean, as worsened, especially after the COVID pandemic, workloads and working hours are even higher. So it is very interesting from this point of view. There is more awareness about fatherhood, but the workloads are super high, and it is very interesting because we are moving, I mean, on another direction compared to other countries who are reducing working days or working hours. And in Italy, there is a strong resistance on this point. And in fact, we have the lowest fertility rate in Europe. So
very interesting.
But there's also
Martin,
quite a big difference between North and South.
Mm-hmm.
I mean, you know, the way work is organized too. I mean, there's more informal work. It's there are huge variations. But time back, I saw an interesting document circulating that was published by some EU entity. It was called Changing the Culture of Long Working Hours in Europe. And I don't know whether that went anywhere. It's quite an old report. But it's a big issue because, I mean, there is, you know, actually the evidence shows us that when people work beyond a certain number of hours, their level of productivity plunges. So, you know, it doesn't really make sense from a managerial point of view. Martino, you got comments?
Martina, you would like to comment as well? We are receiving some comments and questions also in the chat.
Oh, good.
Martino,
question, more of a comment, because one of the feedback, and like one of our more expert members as an organization on this topic is one of the participants to this meeting. So I would like to defer even to Carolina Andrian. But one of the feedbacks I think we receive often from Poland, one of the what you call as like areas on which members like Share the Care, Carolina's organization is most keen to work on in Poland is on, I would say, like the educational component of fostering these partnerships between men and women parents. And I was wondering, in relation to Italy, what do you think is the level of awareness on the benefits of shared partnerships, both at the level of male parents and at the level of employers, because I know that members organization we have that actively campaign for these gender responsive parental partnerships are working on these two components, like the employers building awareness of what the benefits of flexibility, the possibility of flexibility, what the normative framework is around leaves, and on men that are not always aware of the advantages of taking leaves. So there was a question on the Italian situation.
Yeah, who would like to answer that one?
Well, I think we share the analysis on this point. I mean, the level of awareness is extremely low, and there is some attitude which is changing, but the attitude is not really based on awareness. The attitude is rather moved by a sort of generic move to some which is more relational in general. I mean, people and young people feel that society is getting too material, and they strive to be more interested in relationship. Some of those, not all of them, okay? But this is a move, but there is no awareness about the internal benefits of being an engaged father. One thing which is very interesting is, and there is a lot of research on it, are the so-called triggers of engaged fatherhood. Just to make an example, you know, skin to skin at birth is triggering engaged fatherhood. Shared reading is triggering engaged fatherhood, and so on. And I think we have to build on those, because I don't think that most of fathers would listen to our preaches about them being better fathers. Rather, they should discover this or be moved to this by their testosterone to oxytocin relationship, which is going to change after they have the baby skin to skin, you know. So we have to work on these triggers and to situation that may be able to encourage engaged fatherhood. But this is one of the many issues that we have on the table. The awareness is low, and even companies are more interested to the benefits that companies get from the fact that new fathers and mothers are more, let's say, empathetic in general sometimes. To focus, and they are interested in focusing on the benefits of having more parents among their employees, because apparently parents are more collaborative, let's say. Okay, but not for the benefit of the parents, but for the benefit of the company. But they are ready to understand, I think, more, and I think we right, Maddalena, we were even surprised by the level of interest that our work found in some of the companies, probably the big ones.
It shows also there's also need, understanding of the need, maybe step by step. I'm also mindful of the time, and we have two questions. I don't want to finish without touching on them very quickly. Carolina is asking specifically for Italy, why are you advocating on increasing paternity leave instead of making 3 months of paternal leave non-transferable and maybe increasing the payment from 80% to 100%? And we also have another question that was related to being a parent and understanding the benefits. Mihail is also asking also about the cultural construct of being a parent, male or a female, which is devalued by the societies nowadays. Are societies encouraging people to become parents? I think it also gives a broader perspective of looking at being a parent. What does it mean to be a parent in the current era of things? So we have these two questions, and we are entering our last 5 minutes. If participants can stay a bit longer, we can take 5 more minutes too, but let's be mindful of the time and try to come back.
I can take the first.
Yeah.
We're actually focusing on both the paternity leave, but simply 10 days is simply too short. We need fathers to be able to have these initial 2 weeks at least together with the mother and with the child, because it's a trigger. Because there is research that says that when fathers have that experience, this kind of intimacy, this closeness, they will then make an effort to spend more time with their children. So increasing that is tremendously important. But yes, of course, we're working on the paternity leave, and we've taken this opportunity because the government has said, and it's a good thing, we're raising 30% is simply not adequate according to standards. I mean, that principle of adequate is much too vague. 30% is definitely not adequate. 80% is a lot better. And so we've said, okay, since it's the government that's actually put the money in the budget to do that, what we're suggesting is, look, guys, there's a very simple way for you to increase the paternity leave that's available for fathers if you make one of those 3 months non-transferable. So we've had to be clever and try to fit into what the government itself is proposing and see how to make it better. So we definitely have to work at the 2 levels.
Yeah, exactly. Any other comments?
The other question was a bigger one, which I lost a bit.
It was about, I think we discussed a little bit about it, also the understanding of being parents, being the parenthood being devalued by societies, maybe the social construct of
I would try to provide a
parent.
20-word answer to this. Now, for example, Italy now is not much, but more interested than in the past to encourage people to produce children, not to become parents. And there is a big difference there.
Yeah, true. Maybe this culture is also something that we need to work on.
Yeah,
because
I think that's pensions, especially.
Yeah, young people are being, I think, kind of discouraged how also all of the things are going on in the world. And I'm not surprised that you give this. Yeah, sorry. Yes, go ahead.
Yeah,
Margaret.
sorry. I think that the idea of producing children in a very mechanistic way is not the answer, clearly. I think we'd all agree with that. But for young people, next generation, I think the obstacles are often clearly not that we devalue parenthood, but they cannot imagine how they can financially afford to be a parent because of the housing situation across the world, actually. And, you know, you need a nest of some sort to have a baby or to have next generation, even if it's a small nest. And if you can't separate, I mean, when, you know, I know